You are standing in front of your bathroom mirror this morning. Same face, same light, same 30 seconds before you start your day. And something stops you. The jawline that used to be sharp is now soft. The skin under your chin has moved somewhere you did not invite it. The corners of your mouth pull slightly downward. The hollows under your eyes are deeper than they were 2 years ago. You do what everyone does. You place 2 fingers along your jaw and lift. And for a moment, for 3 seconds, you see the face you recognize. Then you let go. You have tried the creams, the expensive ones and the drugstore ones. You have read about retinol and collagen peptides and facial massage. You have done the exercises you found online, the ones where you chew air and puff your cheeks and tilt your head back and hold it, and the face in the mirror keeps moving in one direction. Down. Let me tell you something today that nobody at a dermatology consultation is going to volunteer, because there is no procedure code for it and no product to sell alongside it. Your face is not sagging because your skin got old. Your face is sagging because of what happened to your spine, specifically what happened to your neck. And I'm going to show you exactly how those two things are connected, why the connection is anatomically direct and mechanically unavoidable, and the one specific exercise, 60 seconds, no equipment, done in a chair that begins to reverse it. Stay with me through the explanation. Because if you skip the mechanism and go straight to the exercise, you will do it half-heartedly and quit in a week. But if you understand what is actually happening inside the structure of your face and your neck right now, you will never miss a single session. If this channel is new to you, subscribe and join us on the way to 100,000. We are building something here that your doctor's appointment simply does not have time for. First, I need to dismantle something. The standard explanation for facial sagging goes like this. Collagen breaks down with age, elastin fibers lose their spring, and gravity pulls everything south. That story is partly true. Collagen production does decline, roughly 1% per year after age 30. Elastin does lose some recoil, but here is the clinical problem with that explanation. It treats the face as if it is isolated, as if the skin is a balloon that simply deflates, as if gravity is pulling on the skin directly. It is not. Your face is not a balloon. It is a layered structure of bone, fat compartments, muscles, and a continuous sheet of connective tissue called the SMAS. The SMAS, the superficial musculoaponeurotic system, is not something you will hear about at a skincare counter, but it is the exact structure that surgeons lift when they perform a facelift, not skin. The SMAS. Because lifting skin alone produces that pulled, unnatural look, lifting the SMAS produces a face that looks genuinely younger because the structure underneath has been repositioned. And here is the part nobody tells you. The SMAS does not stop at your jawline. It continues down your neck. It connects directly to the platysma, the thin, flat muscle that covers the front and sides of your neck, from your collarbone all the way up to the corners of your mouth. One continuous fascial sheet. One structural layer. Your face and your neck are not separate systems. They are the same system, which means that whatever is happening to your neck is happening to your face. There is no partition between them. There is no barrier. It is one continuous structure, and what pulls on the bottom pulls on the top. Now, I want you to think about how you spend your day. You read, you scroll your phone, you work at a desk, you eat meals, you watch television. In each of these activities, your head tilts forward, not dramatically, not uncomfortably. Just a few degrees, a few centimeters, it feels completely normal. You do not notice it at all, but your cervical spine notices. The cervical spine, the 7 vertebrae in your neck, is designed with a specific curve, a gentle backward arch called a lordosis that positions the skull directly over the shoulders. In this position, your head, which weighs between 10 and 12 pounds, is balanced. The muscles holding it up are doing very little work. The load is distributed through the discs, the joints, the ligaments. Move that head forward by 1 inch, just 1 inch. The effective load on your cervical spine jumps from 10 pounds to roughly 27. That is not a metaphor. That is biomechanics, measured and documented in the literature on cervical spine loading. Move it forward 2 inches, and the load climbs toward 40 pounds. 3 inches forward, which is entirely common in adults who have spent years working at a desk or looking at a phone, and the effective weight your neck muscles are trying to support exceeds 60 pounds. 60 pounds, held all day, every day, for years. Your neck muscles do not politely ask for a rest. They adapt, they shorten. The muscles at the back of your neck become chronically contracted. The muscles at the front become chronically lengthened and weakened. And the entire column of tissue from the base of your skull to your collarbone shifts its resting position forward. Now here's where the face enters the picture. And I want you to follow this carefully because this is the chain of events that explains what you see in the mirror every morning. When the cervical spine loses its natural curve and the head shifts forward, three things happen to the tissue above the neck. The first is a direct mechanical pull. Remember the platysma, the muscle that connects your collarbone to the corners of your mouth. When your neck posture changes, when the column of your neck tilts forward and your chin descends toward your chest, the platysma is pulled downward, not all at once, not dramatically, but constantly. Day after day, month after month, year after year, the muscle, because it is continuous with the SMAS, transmits that downward tension into the lower third of the face. The jowls you see forming along your jawline are not simply loose skin. They are tissue that has been mechanically dragged downward by a muscle under sustained abnormal tension. Think of it like this. Imagine a theater curtain hanging perfectly from a horizontal rod. Beautiful, even, smooth from top to bottom. Now imagine someone grips the bottom of that curtain and pulls it consistently to one side. The fabric does not tear. It bunches. It folds. It loses its clean vertical hang. The curtain has not aged. The fabric has not deteriorated. The rod tilted and everything hanging from it followed. Your cervical spine is the rod. Your face is the curtain. And the tilt has been happening for years. The second thing that occurs is compression of the suboccipital space. The suboccipital region is the area at the very base of your skull, just where your neck meets the back of your head. In this region sit four small but critical muscles, and directly alongside them run the suboccipital arteries and the channels of your lymphatic system. When forward head posture compresses this space, and it always does, because the skull presses down and back, two things suffer. Blood flow to the scalp, the temples, and the tissues of the face is reduced, and lymphatic drainage from the face is impaired. Lymph, the fluid that clears cellular waste and inflammatory byproducts from your tissues, flows upward and outward through specific channels. Several of those channels pass through or adjacent to the suboccipital region. When that region is chronically compressed, the drainage slows. Fluid accumulates in the facial tissues. You wake up puffy. The puffiness becomes persistent. Over time, chronically underdrained tissue loses its structural clarity. The face looks heavy, not just loose. The third effect is on the fascia itself. Fascia, the connective tissue web that wraps and connects every structure in your body, responds to sustained mechanical loading by remodeling. It thickens in the direction of load and loses tension where it is chronically slack. When your neck is forward, the posterior fascial layers at the back of your neck thicken and stiffen. The anterior layers, the ones connecting upward to your face, become elongated and lose their holding capacity. Slack fascia does not support tissue. It lets it drift downward. So, to summarize the chain, forward head posture compresses the suboccipital space, reduces lymphatic and vascular drainage to the face, creates a sustained downward mechanical pull through the platysma and SMAS, and causes the fascial scaffold of the lower face to lose tension. All of these effects produce facial descent, not aging, not bad genetics, mechanics. And mechanics can be corrected. Consider someone I'll call Dorothy, 64 years old, retired school teacher. Spent 30 years looking down at papers, then another decade looking down at a tablet. Sharp woman, organized, takes care of herself. She came in with a folder that contained, in order, a receipt from a high-end skincare clinic, 3 printouts about collagen supplements, and a consultation summary from a cosmetic surgeon recommending a thread lift. She was not there because of pain. Her neck did not hurt. She had no headaches, no arm tingling, no stiffness she considered remarkable. She was there because a friend mentioned her posture had changed. She wanted to know if that was connected to what she called her face falling apart. The answer was visible the moment she walked in. Her ear was positioned approximately 3 inches in front of the center of her shoulder, which is the standard landmark for assessing forward head posture. Her chin was slightly depressed. The muscles along the back of her neck were visibly raised, tight bands running from skull to shoulder blade. The front of her neck showed none of the normal muscular definition. Everything had drifted forward. I asked her to sit tall and gently draw her chin straight back. Not up, not down, straight back, as if making a double chin deliberately. She laughed, said it felt ridiculous. I asked her to hold it for 10 seconds and then look in a mirror. She was quiet for a moment. "My jawline is back," she said. Not permanently, not from 10 seconds of one movement, but she saw the direction. She understood in that moment that what she had been looking at in the mirror every morning was not the verdict of aging. It was the consequence of a structural position that had developed over decades. And structural positions, given the right input consistently applied, can be changed. You can assess your own posture right now without any equipment in under 30 seconds. Stand with your back against a flat wall. Your heels should touch the wall. Your shoulder blades should touch the wall. Now, does the back of your head touch the wall comfortably and naturally? Or does it require deliberate effort? Or does it simply not reach? In optimal cervical alignment, the back of the head rests against the wall with no strain. The skull sits balanced directly over the spine, the chin is level with the floor, and the contact feels easy. If you had to strain to get your head to the wall, your cervical curve has been compromised. If your chin lifted when you tried, if your head touched the wall but only by tilting your face toward the ceiling, that tells a slightly different story, but one equally worth addressing. Take note of what you felt, because the exercise I'm about to describe will change that test result. And in changing that result, it will begin to change what you see in the mirror. Before the protocol, a brief word about why the things most people try do not address this mechanism. Facial exercises targeting the cheeks, the mouth, the forehead, these are not useless, but they are working on the curtain while the rod stays tilted. You can exercise the muscles of your face while the structural pull from your neck continues, and the results will be modest. Creams and serums, even well-formulated ones, work on the surface layers. They cannot reach the SMAS. They cannot release a chronically contracted platysma. They cannot restore a compressed suboccipital space. The surface of the skin is not where this problem originates. Collagen supplements. Evidence for oral collagen improving facial tissue structure is mixed and largely related to skin hydration and surface texture, not to the mechanical descent of the deeper fascial layers. You cannot supplement your way out of a postural problem. Use these things if you find value in them, but do not expect them to move tissue that is being held in the wrong position by a structural force they cannot reach. That is not what they do. The protocol has 4 sequential parts. Each part has a specific physiological purpose. Do them in order. Do not rush any part. The total time for one cycle is approximately 60 seconds. Do 3 cycles per session. Do 1 session in the morning and 1 in the evening. Part 1. The cervical retraction. Sit in a chair with your feet flat on the floor and your spine upright, not leaning against the back of the chair. You are sitting on the front 2/3 of the seat. Now, without tilting your chin up or down, draw your head straight back. Think of it as sliding your skull backward on a perfectly horizontal track. You will feel the muscles at the back of your neck gently engage and the muscles at the front of your throat lengthen. Your chin will naturally form a slight crease. That is correct. Hold this position for 10 full seconds. Breathe normally. Do not hold your breath. After 10 seconds, release slowly forward. That is 1 repetition. This movement does several things simultaneously. It activates the deep cervical flexors, the small stabilizing muscles that run along the front of the cervical vertebrae, muscles that are typically profoundly weakened in forward head posture. It stretches the suboccipital muscles at the base of your skull, releasing compression from that critical drainage and circulation region. and it mechanically restores, even briefly, the natural lordotic curve of your cervical spine, giving the discs and joint surfaces a moment of proper load distribution. Part 2. The crown lift. From the retracted position, do not release it. Imagine a thread attached to the very crown of your head, pulling straight upward toward the ceiling. Do not raise your chin. Do not shrug your shoulders. Simply grow taller through the top of your head. You are creating length through the entire cervical column, gently decompressing each disc and joint space. Hold for 5 seconds. What is happening here is self-applied traction, the same principle behind clinical cervical traction used in physical therapy, generated by your own postural intention rather than a machine. This momentary decompression allows the suboccipital arteries and lymphatic channels to open. Done consistently over weeks, this directly addresses the drainage impairment that contributes to chronic facial puffiness and tissue heaviness. Part 3. The suboccipital release. Gently lace your fingers together and place your hands behind your head, specifically at the junction of your skull and neck, not lower on your neck, but right at the base of the skull. Apply the lightest possible upward pressure with your palms, as if you are cradling the weight of your head and offering to carry it for a moment. Now perform 3 very slow, very small nods, chin gently toward chest and back to level. The range of motion should be no more than an inch or 2. You are not exercising, you are releasing. The suboccipital muscles, when chronically tight, respond to sustained, gentle pressure combined with small range movement. They let go. The vascular and lymphatic structures they were compressing begin to open. This is the step that most directly addresses the drainage component of the facial sagging mechanism. Part 4. The platysma activation. Sit tall. Tilt your chin very slightly upward 5 degrees, no more. Now press the tip of your tongue firmly against the roof of your mouth and hold it there. In this position, swallow deliberately. You will feel the entire front of your neck engage, from your collarbone upward to your jawline. Hold that engagement for 5 seconds after the swallow, then release completely. This is not a vanity movement. You are recruiting the platysma and the suprahyoid muscle group, the muscles of the front of your neck, in a pattern of upward contraction. This is directly opposite to the downward pull they have been under from years of forward head posture. With consistent repetition, the resting tone of the platysma shifts. Its baseline mechanical influence on the SMAS changes. The tissue it was pulling downward begins to experience less of that force. 3 days of consistent twice-daily practice. The wall test becomes easier. Your head reaches the wall with noticeably less effort. Some people experience this after a single session. Do not mistake that early shift for the complete result. It is the muscles releasing their acute tension, not the structural change completing itself. 2 to 3 weeks of consistent practice. The suboccipital compression begins to reduce. Facial puffiness, particularly in the morning, starts to diminish. The face looks less heavy in early morning photographs. Some people notice that others comment on them looking rested. 6 to 8 weeks. The deep cervical flexors begin to rebuild genuine strength. The cervical curve starts to restore its natural shape. The downward mechanical pull from the platysma and SMAS decreases meaningfully. This is typically when other people begin to notice without being told. 3 to 6 months. Structural change that holds. The postural pattern established over years or decades does not reverse in weeks, but the direction of change is established by week 2. And the body, given a consistent mechanical input, will follow that direction. Between sessions, posture awareness becomes the maintenance work. Every time you look at your phone, raise it toward your eyes rather than dropping your chin to your chest. Every time you sit at a table, bring the fork toward your face rather than your face toward the plate. These are small adjustments, but they stop undoing the work the protocol is doing. If you feel tingling, numbness, or weakness traveling into your hands or arms when you perform the retraction movement, stop and see a clinician before continuing. That pattern can indicate nerve compression in the cervical spine that requires evaluation before therapeutic movement. If you have been diagnosed with severe cervical stenosis, a narrowing of the spinal canal, discuss the extension components of this protocol with whoever manages your care before beginning. If you have had cervical surgery, a spinal fusion, or a significant disc herniation, these movements may be entirely appropriate or may need modification depending on what was done and when. Have someone familiar with your history review the protocol. For most people without these specific conditions, the movements involved are well within a healthy cervical range of motion and carry minimal risk. But your history matters, and the 3 minutes it takes to check is worth it. Here's what I want you to do in the next 12 hours. 1. Do the wall test right now or tonight before you sleep. Heels to the wall, shoulders to the wall, note where your head lands. Take a photograph of your profile from the side, from the neck up. That is your baseline. 2. Before you sleep tonight, do 1 full session of the protocol, all 4 parts, 3 cycles. Move slowly and deliberately. Rushing removes the therapeutic effect. 3. Tomorrow morning, the first time you look at your phone, raise it to eye level deliberately, just once, intentionally. Notice what that 1 change does to your chin position and your neck. 4. Repeat the wall test in 2 weeks. Compare the photograph you took tonight. The change will be measurable. 5. Give the timeline the respect it deserves. The structural shift you are reversing took years to develop. It will take months to fully correct, but the direction of correction begins in days. And a direction, maintained consistently, becomes a destination. Before you go, I have 1 question for you. How old are you, and where in the world are you watching this from right now? Write both of those in the comments, not out of curiosity, but because the age distribution of this audience directly shapes what comes next. The mechanism I described today, forward head posture, SMAS tension, suboccipital compression, fascial remodeling, it affects people at different intensities, depending on how long the pattern has been in place, what their occupational history looks like, and what hormonal changes have occurred alongside it. If the majority of you are in your 60s and 70s, the next video will address how estrogen and testosterone loss after 60 affects fascial holding strength specifically, and what can be done about it. If many of you are in your 50s, the lymphatic drainage piece deserves a fuller video of its own, because that is the decade where intervention has the most dramatic results. Your age, where you are watching from, both of those matter. And if you have someone in your life, a sister, a husband, a friend, who keeps spending money on creams and getting nothing back, share this with them. The answer was never in the cream. It was in the structure behind the face. And structure, with the right input, consistently applied, always responds.